Chapter 1 Introduction to Cranial Sacral Therapy. Overview. Cranial sacral therapy is a gentle, hands-on approach to bodywork. It focuses on the bones of the head, spinal column, and sacrum, and the underlying structures. The goal of cranial sacral therapy is to release tensions in the tissue that surrounds and protects the brain and spinal cord, thus providing an optimal working environment for the central nervous system. This can, in turn, result in a positive impact for all other systems of the body. As a therapist, your main objective of this work is to find and release tensions, called restrictions and/or compressions, in the craniosacral system, and gently use specifically designed non-intrusive techniques to release these areas. Craniosacral therapy can be used alone or incorporated with other bodywork. Listed below are a few of the symptoms, conditions for which craniosacral therapy is useful. More will be discussed with the progression of the course. Chronic pain, especially in the neck and back. Headaches, tension, migraine, cluster. TMJ dysfunction, emotional trauma, stress-related dysfunctions, arthritis, colic, inner ear problems, learning behavior disorders in infants and children. History. Craniosacral therapy has its roots in cranial osteopathy. In the late 1800s, William Sutherland, an osteopath, became intrigued by the skull and its bone formations. Through intense study of skulls, Sutherland found that bones are formed to encourage natural movement at the sutures. He named this movement the cranial rhythm. Sutherland discovered that by inhibiting the movement of individual bones, specific dysfunction in the head and body was created. He also found a direct link between the bones of the head and the sacrum, noting movement in the sacrum was a part of the cranial rhythm. Cranial osteopathy was practiced only by a small group of osteopaths and chiropractors until the 1970s, when John Upledger, an osteopath, became interested in the work. Knowing there was a great debate on whether movement occurred in the skull or whether the bones were solidly fused, Upledger and a team of research scientists conducted studies to prove or disprove movement. They injected a dye into the sutures of fresh cadaver specimens. This dye turned blue, which indicated the presence of collagen and elastin fibers. Another experiment conducted used live monkeys and radio antennas. They secured the antennas to the monkeys' heads and monitored movement electronically. This study showed that the bones move and that they move in specific directions. Craniosacral therapy has come a long way in 100 years. There is still much we do not empirically know about the work. We know the bones move. We can feel and see the movement. Brain surgeons have noted this during surgery. However, we still do not know what creates the movement. Craniosacral therapy works with a physical system, applying subtle pressure in a very precise manner to encourage results favorable to the body. The craniosacral system is comprised of the following structures: the brain, spinal cord. The brain and spinal cord are very important parts of this system. The brain creates all thought and movement, and the spinal cord relays the information to the rest of the body. If pressure or impression occurs, adverse messages can cause dysfunction. Meningeal membranes. This membrane system is made up of 3 layers: duramater, arachnoid membrane, and pia mater. For our purposes, we will refer to the system as the reciprocal tension membrane. The duramater, tough mother, is tough connective tissue. It envelopes the brain and spinal cord and contains the cerebrospinal fluid. Cerebral spinal fluid. Cerebrospinal fluid, CSF, is produced within the ventricles of the brain, mainly the 3rd and 4th ventricles. It's a highly filtered blood plasma and is produced from the blood. The blood enters the ventricles of the brain and flows through a filtration system in the ventricles. CSF maintains the environment in which the brain and nervous system function. It's responsible for lubricating and cushioning the brain and spinal cord. The cranial sacral system is responsible for the production, circulation, and reabsorption of CSF. If an injury or trauma has occurred to the cranial sacral system and inhibits the flow of CSF, dysfunction and disease can be created. The bones. The bones of the head, spinal column, and sacrum are an important part of this system. They serve as handles to what is going on underneath. Their movement or lack of movement indicates where dysfunction lies. Compression or injury to the bones can adversely affect the underlying structures of the system. Cranial sacral rhythm. The cranial sacral system produces a rhythm, much like the cardiac and respiratory systems. This movement is the movement of cerebral spinal fluid throughout the cranial sacral system and is known as the cranial rhythm. Learning to feel the movement of the cranial rhythm enables the therapist to identify restrictions and compressions in the cranial sacral system. Restrictions and compressions in the cranial sacral system reduce or inhibit the natural movement of the cranial rhythm and may even show up as areas of non-movement. Restrictions and compressions are caused by injury or trauma, and if not corrected, can lead to dysfunction and disease in the body. Although it is an accepted fact that cerebral spinal fluid circulates throughout the cranial sacral system, it is still unknown what propels or causes the movement of the CSF through the system. Below are 3 theories relating to the cause of cranial rhythm movement. Cranial sacral rhythm origin theories. Osteopathic theory. Sutherland suggested the brain has a contractile capacity. Thus, the force creating the movement is the brain expanding and contracting in rhythmic cycles. As the brain expands, it creates an outward pressure on the bones, pushing the bones in a lateral direction. As the brain contracts, the bones drop back medially. Up-ledger theory. The cranial movement is based on the rise and fall of cerebral spinal fluid. As the ventricles of the brain pump CSF into the membrane system of the brain, the pressure from the fluid produced creates an expansion in the head. A nerve located in the sagittal suture monitors the expansion. When the head is fully expanded, the nerve fires to the ventricles to stop pumping fluid, and the elastin fibers in the suture bring the bones back into extension stage. Energetic theory. This movement created by our energetic systems is believed to be the most ancient rhythm in our bodies. Following evolutionary thought, some believe we crawled out of the sea with this rhythm intact. The cranial rhythm has been observed in dolphins and fish. The cranial rhythm is the cranial sacral therapist tool for identifying restrictions and compressions in the cranial sacral system and consists of 2 basic movements: flexion, extension. Flexion is when the head becomes wider transversely and shorter in its anterior-posterior dimension. An easy way to remember this: flexion equals fat head. Extension is when the head narrows transversely and elongates in its anterior-posterior dimension. An easy way to remember this is extension equals skinny head. The cranial rhythm normally cycles 6 to 14 times per minute. One complete cycle includes flexion, a slight pause, then extension. Variations to movement patterns often occur, especially in cases of injury and trauma.